Good afternoon. I'm Michelle Williams, Dean of the Faculty here at the Harvard T.H. Chan School of Public Health. Thank you all for joining us this afternoon. We are thrilled to present part 3 of our ongoing series, When Public Health Means Business, a series developed in partnership with the New England Journal of Medicine, a partnership with shared intentions of bringing together the best in science, research, clinical relevance, and policy translation. Just a few months ago, we were all hurtled into a new normal. It was just the beginning of lockdowns, physical distancing, and our new custom of wearing masks. The world suddenly looked like a large and very different place. As of today, COVID-19 is still very much center stage, even if some would have us believe otherwise. There are over 8 million cases globally and 440,000 deaths worldwide. I just read a tweet from CNN's Sanjay Gupta that captured the moment perfectly when he said, "It's kind of remarkable to me that people still in many places seem to have forgotten about the virus. But clearly, in most places around the country, the virus has not forgotten the people." For those of us in public health, this is our worst case scenario. And then, just 4 weeks ago, we witnessed the horrific murder of George Floyd, 8 minutes and 46 seconds with a police officer's knee on his neck. An act, according to the New Yorker writer Jelani Cobb, that is defined by its casual sadism. These acts of casual sadism have been inflicted upon the bodies of Black and brown people for far too long. And it's not just the constant police brutality, nor is it just the persistence of health disparities and health inequalities in our country. It's about inequities in housing, education, employment, access to quality health care, and all those things and more. Racism is a public health crisis because it permeates every social determinant of health. It's 2020, and we are still up against 400 years of pernicious and pervasive systems built to oppress Black and brown people in this country. So dismantling those systems will take enormous, sustained effort over many years, and all sectors, along with public health, must be engaged. What will it take to dismantle systemic racism? How will science, public health, and business lead the way? We are at the very crossroads of business and public health, and in order to move forward, it is imperative that public health in all of its forms mean business. That means we need to build a 21st century public health system that can effectively protect all of us. That is an ambitious goal, I am sure, especially since the US currently invests only 2.5% of all health spending in our country into public health. That meager percent amounts to a meager $274 per person per year. We must invest more to see positive returns and positive change. But it's also going to take more than just money. We must also invest with our hearts and minds. We must invest in human capital, in societal capital, in order to create shareholder values for all of us. The rigors of science and health must take equal priority to profit and wealth. And if we add compassion and justice to that equation, we'll have all the more reason to be hopeful. I believe in public health. I believe in this country, and I believe in the human spirit. COVID-19, the economic crisis, and racism brought us all to our knees. And the plain truth is we can no longer engage in silos. These three crises demand a remarkable level of cooperation and coordination across all sectors and disciplines. And that is the exact mission of these conversations when public health means business. We have no choice but to use this moment to restore America's public health infrastructure and America's faith in itself. Today, I am honored to continue the conversation. Please welcome our special moderator for today, Ali Velshi, host of Velshi on MSNBC, and our very special guest and friend, Larry Summers. Ali, we watched you valiantly reporting from the front lines in Minneapolis. Before we get started in this conversation, can you share with us a little, how did this reporting on the front line impact you, and how are you doing today? Thanks again for joining us.
Thank you, Dean Williams. And in fact, I was going to be at an earlier one of these sessions with you, and I was unavailable because I was out there in the field. Impact's an interesting word because I got the direct impact of a rubber bullet. And I was one of more than 300 journalists who have had negative interactions with the police over the last 3 weeks, which is, by the way, something we are not used to here in the United States. I've got a flak jacket. I've got a helmet that repels projectiles, and I've got a gas mask, and I've never, ever, ever used them in the United States prior to the last couple of weeks. I'm fine. I got a bit of a bruise. There's a fellow journalist of ours who lost her eye, and she's a photographer. She jokes that it's not the eye she uses to shoot with, so she'll be fine. But if journalists are the threat, and I think Larry will agree with us, having been in government, if we're the threat, you're doing something wrong. Our job is to bear witness and to hold power to account. And as I remind people, if we are not able to bear witness, we're not able to be there to show you what's happening, it becomes very difficult to hold power to account. So I think the issue here is the First Amendment and how we treat the press and who the government works for and who the police work for. And we're hopefully going to get some answers to that because it is something that the country is very concerned about at the moment. So thank you for asking. Thank you for having me here. And Larry, welcome to you. The difficulty with interviewing you it's always been the same, whether it's here or it's when I have you on TV, and it's this. This is the short version of your bio. And it's not just that it's long and complicated. It's that you've actually, I don't even know what to call you. You've been a Treasury Secretary. You've been the chair of the Council of Economic Advisors for the president. You've been the president of Harvard. We always have this just jostling when people have had various titles, ambassador, senator, treasurer, secretary, what we call you. So I'm going to stick with Larry for now. But you are the most esteemed Larry that I ever speak with. So thank you for being with us. It's good to see you again. And I want to just quote you for a moment, in that you've said recently that, quote, an effective government and a certain cohesion within society are necessary prerequisites for economic success. Without broad societal legitimacy, there can be no enduring prosperity. And broad societal legitimacy, it seems to me, is under question right now in a way that has not taken place in the United States since the late 1960s, end quote. That's to do with so many things. That's to do with our institutions. That's to do with our government. That's to do with our police. Nobody seems to try, it's to do with media. Nobody seems to trust anybody anymore. So it's hard to determine how policy is made and carried out when we don't have broad societal legitimacy.
Yes to everything you said, Ali. It's a pleasure to have a chance to be talking with you again and to be talking at slightly greater length than one can on television. It's a great pleasure to be with Dean Williams and a number of her colleagues from the Harvard School of Public Health. I concluded during my time at Harvard that there was probably no other school at Harvard that combined as much rigorous science with as much social impact as the public health school did and does. Whether it was figuring out how to cure malaria or introducing the concept of the drunk driver, of the designated driver, whether it was contributing to the design of national health insurance or understanding and developing the first epidemiological models around each of the various pandemics that we have faced. The public health school has been right on the front line and is the very exemplar of engaged scholarship. And I am, on behalf of Harvard, very proud and think that it is one of the brightest jewels in Harvard's crown. Look, we can discuss the right policies for any problem. We can discuss the right ways to execute those policies. But there is a sense in which the success of a society depends upon a kind of mutuality, a confidence that when a police officer pulls you over because you might be speeding, that you do not have to fear for your life or for your money. A sense that when you pay your taxes, you are not being a chump because the government is successfully collecting taxes from the citizenry. A sense that when you drive across a bridge, the bridge has been constructed well enough that it is not going to collapse. The sense that you can give your children a bath without a little bit of water going into their mouths, putting their future intelligence at risk, as took place in Flint, Michigan. And I could go on with examples like this. At the broadest level, those of us who have been fortunate have an obligation to conduct ourselves, to encourage others in ways that give a basic confidence that while there will always be disagreement about means, that the society is united around ends of decency, effectiveness, fulfilling lives for all the people who were born into it. And when you see the kind of breakdowns that we've seen, let's not mince words. Tens of thousands of fewer people would have died if the US government had carried out the basic task of preserving and protecting the Constitution of the United States and American citizens more competently than they did. That is a spectacular failure. The events in Minneapolis and in a number of other cities, which represent those whose job it was to be a source of safety, being instead a source of danger, are another example. And figuring out how, through all our institutions, all the ways we come at problems and all the ways we conduct ourselves, how to restore a sense that we are a society that is coming together and progressing, rather than a society that is falling apart and regressing. That's really the ultimate question.
Let's go to what Dean Williams was talking about. As of this morning, according to Johns Hopkins, we've got more than 8 million coronavirus infections around the world, 444,000 deaths, 2.1 million infections in the United States, and 117,000 deaths in many states. the numbers have not peaked and are in fact increasing. There are several states now that are seeing their highest numbers of hospitalizations. We did have the president say a couple of days ago that if we simply stop testing, we'd have fewer cases, which I think is a misinterpretation of how data works. But I want to just play for you very briefly something that Arnie Epstein, the Harvard Chan health policy expert and the associate editor of the New England Journal of Medicine, reflected on the magnitude of this crisis. And when he did so a few days ago, the numbers were smaller that he quotes. But the point he makes, I think, is relevant. So let's listen to it.
COVID-19 isn't just a fire, it's a conflagration. In 3 months, we've lost 100,000 Americans. In 3 months, the unemployment rate has gone from 3.5% to over 14%. That kind of clinical and economic carnage has an impact.
Larry, how do you solve for that? Because one of the problems we've got, as you mentioned, with coronavirus is if the government had acted on this sooner, there are studies that indicate fewer people would have died, and may still may not have died. Here's the problem. It does come back to this issue of trust. It does come back to the issue of legitimacy. We've got an administration that sort of sometimes takes us seriously, sort of sometimes doesn't. A president that argues for medications that are not proven and claims that there's going to be a vaccine by November. So what happens is it starts to become political, right? What you believe about coronavirus starts to become what you hear on the cable channel that you prefer.
It isn't easy. We've had an ongoing abdication of responsibility up until this moment. It is insane that we spent more than $3 trillion on economic stimulus, but we haven't been able to spend $30 billion on putting testing in place. It is crazy that we are investing as much money as we are in bailing out the largest corporations in the country and investing so little money in providing jobs as contact tracers to those who are unemployed. There are aspects of this that are the biological equivalent of rocket science. But there are aspects of this that are entirely straightforward, that are entirely a matter of will and competence, and we are not doing them. If there were tests available, people would take the tests. If there were contact tracers, not everybody would answer the phone, but the vast majority of people would answer the phone. We have lost tens of thousands of lives because of mistakes we made in the past, and we are in the process of making more mistakes that will cost thousands, probably tens of thousands, more lives in the future. We can do better as a country. We have done better as a country, but it requires a stable, steady commitment to truth-telling. The American people would trust Dr. Fauci. It's not hard to have political leadership which looks to generally respected experts for scientific parameters. Unfortunately, at the national level and in too many of our states, that is not what we are having. And we need straightforward, trusted leadership that speaks plainly and clearly.
You know, my area of expertise has been economics, and yet when I need real economic stuff, I turn to experts like you. In the same case, when we need to understand public health, we've turned to public health experts, and there are many of them, in fact, many of them from Harvard, who we turn to try and give us a story, what's going on. We heard in one of the prior segments from Peggy Hamburg, who's a foreign secretary of the U.S. National Academy of Medicine, former FDA commissioner, former New York City health commissioner. Let's listen to what she's had to say.
I have spent most of my career working at the sort of perilous interface between science, medicine, public health, and politics, since most of my my professional life has been in government service. You know, I feel very strongly that public health needs to be true to the science and the data. It needs to be able to speak truth to power. It needs to recognize that its information for decision making is going to enter a broader sphere where there will be politics and competing priorities and other things.
It's an interesting point, right? It needs to be able to speak truth to power, and that's generally what we've heard. But you mentioned Fauci. There's a perfect example. Dr. Birx, Dr. Fauci, they come out there, they say things, they then start to seem like they have to hedge things because the president is saying something else. And you've watched those coronavirus briefings where, you know, the camera shows you the reaction of these public health professionals as the president is talking about somehow getting the sunlight inside your body and drinking disinfectant and things like that. So this becomes a real problem for an industry that has some consensus around the data and the facts in medicine versus the power that we would hope would be giving us the right information, but we're learning doesn't.
You know, Ali, I'd like to take this beyond piling on the president, though there's certainly grounds for that. If you look around the world, there are many democratic countries, and many of them have actually done worse than the United States in terms of fatalities per million people, even with all of the problems that we've had that seem like they're unique to us. And so I think we need to look beyond blaming particular leaders and particular personalities, not because they're not blameworthy, but because if we stop at that, we'll miss opportunities to do better. Many of us warned about pandemic risk years ago, and money was not set aside. That was a collective decision in Democratic and Republican administrations by the executive branch and by the Congress that we were underprepared for a contingency of this kind. We have not made sufficient investments recently. Was mentioning before, the testing infrastructure that is necessary, and that mistake has been replicated all around the world. You know, I think the phrase, the moral equivalent of war, ever since Jimmy Carter started using it in connection with the energy crisis in the 1970s, has been rather overused by political leaders. But this really is the moral equivalent of war. And I'm not sure in all our leadership practices we have fully risen to the magnitude of that challenges. I've seen it as an economist, one of the very difficult issues in a society like ours is the relationship between political leadership and expertise. War is too important to leave to generals. Economics is actually too important to leave to economists. And epidemiology is too important, sorry, Michelle, to leave only to epidemiologists. And we need to ultimately have decisions made by politically elected leaders who by necessity are generalists. But they need to give us the confidence that they are absorbing the wisdom of experts and making that the basis for their actions. And they need to convince us that they are acting in their own collective interest, in our collective interest, not in the interest of their reelection or their enrichment. And that our political class needs to act in ways that regain our confidence.
Okay, so earlier in this thing, you don't have to pile on to Trump on this one, but earlier when things weren't going well with those briefings, the president brought in a number of CEOs of drug companies, drug distribution companies, pharmacies, things like that. And I'm tying this to a question that we've got from somebody who's watching this right now, and I do want to invite people to submit their questions. But this viewer submits a question that says, 50 years ago, Milton Friedman declared in the New York Times that the sole duty of for-profit corporations is to maximize profit for shareholders. Since then, shareholder capitalism has been a major force in corporate America, as well as in our economics and business schools. How can we expect such companies to care about the health of populations and society beyond their own profits? The context of this is that at some point we're going to get a therapeutic for coronavirus, or we're going to get a vaccine, or both, and every human in the world who has not got the infection is going to want a piece of that, poor or rich, developed countries or developing countries. So how do we now sort of say the shareholders are everybody?
Ali, you've raised a very, very important set of questions. I'm not where Milton Friedman is on that. I think that companies that want to maximize their long-run shareholder value will also pay close attention to their stakeholders. Because if you don't have customers who trust you, employees who trust you, a broader society who respects you and values your success, you're not over the long term going to be a very successful corporation for your shareholders either. But let's not make mistakes. We need to understand that people and businesses respond to incentives. And frankly, I'm more worried that there's not sufficient incentives right now to develop tests and to get those tests disseminated and distributed, then I am worried that once we get the tests, somebody will charge too much for them. I'm more worried that there isn't sufficient incentive for investing in vaccines, because if what probably will happen does happen, and your particular vaccine pathway fails, you'll fail alone and be out a lot of money. And if your vaccine succeeds, there'll be a clamor from people like your viewer that it needs to be distributed to everybody as cheaply as possible. And therefore, you won't be enabled to earn the very large profit margin that is needed, given that the most likely course is failure. So yes, our corporations have a lot that they need to think about in terms of ethics, but let's not forget that market-based societies are what brought us the environmental movement. Market-based societies are what brought us all kinds of innovations in both public health and innovations in pharmaceuticals and private health. And so I think we need to be very clear and very careful about letting easy moralisms trump what we know works. What important healthcare innovations have come out of non-market economies? I think it's a short list. And so I think we need to find a balance here. It's a balance that respects stakeholders, but it's also a balance that reflects that market incentives are very, very strong. If I'll just take one more minute, because I think this is an important point for your listeners. I remember a discussion when I was president of Harvard about our policies around medical research, innovation, and all of that, intellectual property. And I was saying, look, the university produces this research. Why don't we just make the intellectual property freely available for all of mankind? And somebody said, well, you can do that, but if it's freely available for all of mankind, nobody's going to find it profitable to produce it. Whereas if you sell that property and you license it for an interval to a number of different companies, they will find it profitable to produce it. They will find it profitable to market it. They will find it profitable to cause it to be more disseminated. And so the worst thing you can do if you want this pharmaceutical intellectual property to find a widespread application is to just toss it over and make it completely available to everybody for free. And I think what economics contributes to many problems is a careful methodology for thinking through all the various incentive effects, not because thinking about incentives is somehow better or should trump morality, but because it's the right way to achieve fundamental moral objectives.
So here, let's explore this for a second, because this is actually the civil society interaction that is needed, right? In this moment, we need either a therapeutic, we need either a drug, a treatment, or a vaccine for coronavirus in order to help us economically get back on our feet. In that pursuit, you have drug companies and universities. You have public health specialists, many of whom are at universities. You have a role for government. We have insurance questions about coverage, and we've got moral questions about where the drug or therapeutic or vaccine comes from and how it gets distributed around the world. So at some point, someone needs to figure out how all those interested parties come together, how all the stakeholders come together, the shareholders of the companies, the money for research, the distribution, the Bill Gates of the world, and Gavi and vaccines. Who coordinates that? Who, without taking the necessary incentives out of the system, who coordinates the idea that this will be fair, this will be moral, this will be economically productive, and it will have the necessary incentives to devise the drugs or vaccines that we need?
Since, Ali, you're recapitulating 2,000 years of political philosophy, which is exactly around who's going to make very difficult and very complex decisions where there are many competing interests. I think usually it's best not to have a single decision maker. That was the genius of the founding fathers. It's usually best to have competing viewpoints, competing forums, competing factions. And so I think a political system like ours, messy as it is, probably offers the best prospects. Now, I think that you emphasized something very important before when you talked about the role of the media and the role of journalists in holding power to account. But I think asking these things to be resolved by debate in the public square with transparency, with people being held to account, offers the best kind of answer. I think it's a mistake to think that you want to do things as cleanly as possible. You know, some people say we need to be maximally efficient. We don't want to have redundancy. And I say to them, gee, if you were flying on a plane, would you prefer that there not be a co-pilot because there's redundancy? Or would you say my safety is sufficiently important and things have a way of happening that we probably should have some redundancy in the pilot function? Well, I think we should have redundancy in the pilot function, and I think the same thing in the vaccine development function, and in the therapy development function, and in the testing function. So I think we need to try to celebrate and respect leaders who can succeed and move things along. But I don't think there's any magic bullet of success in terms of a process for making these decisions. And people who think they can make it, I think what we have to fear is people who think that with the power of their personality or the power of their individual judgment, they can make it all simple and just force history forward. Those are the most dangerous people.
I wonder, I hear your argument well about not needing maximum efficiency. I'm wondering whether you would argue that we're even at marginal efficiency, and maybe we need to separate these ideas out, because clearly there are drug companies who are working towards some kind of a solution, and they're working as they should be, and someone will come up with an answer knowing that the likely outcome is failure. Is there a need for government to lead something that feels like a moonshot or a Manhattan Project or the X Prize with which I'm involved to offer an outsized prize for success? In other words,
I think we don't. It's a good question. I think we are neither providing enough insurance against failure nor enough reward for success. And therefore, we are getting insufficient effort on testing in particular, but also on vaccines and therapeutics. For example, there are people who could be producing billions of tests who are saying, well, if I produce all these billions of tests and then we get a vaccine, nobody's going to be interested in my tests anymore. Well, the economic reality is that the virus costs us in the United States close to $10 billion a day, and it costs the world close to $200 billion a day. At that price, if we buy $5 billion of tests that we don't need,
it's fine.
It doesn't matter.
Right.
It's not an important error. Whereas if we slow things up for an extra several weeks, it's an enormously consequential error. And so I'd like to see us have more of a wartime Manhattan Project mentality around this, in which there is a synergy between General Groves types who manage things aggressively and firmly to deadlines, and Oppenheimer types who brought the creative genius that got the problem cracked. And I think those kinds of partnerships are not easy to construct, but they really are essential. And I think the risks that we will look back at this moment and say we didn't try enough, we weren't aggressive enough, we didn't do enough, are an order of magnitude greater than the risks that people will say, they spent too much money, they were too ambitious. If they just had kind of let things go, it would have been okay. And so when I see a fairly clear direction of error, I think we ought to do something about that.
Let's listen to Linda Hill. She's the Wallace Brett Dunham Professor of Business Administration, the chair of the Leadership Initiative at Harvard Business School.
In private, they will admit to me that they are scared, and some of them are also admitting it publicly to their people. As one leader put it, this is about leading through a fog. And if you're supposed to have a vision and you can't see, well, what really is leadership? So what he began to realize is that his natural instincts are exactly wrong. This is not the time to take charge and try to steer the ship. Instead, it's the time to set the conditions for your organization to be agile, for everybody to be an innovative problem solver. And so what we see is these leaders are trying to figure out, again, going against their natural instinct, how do I set up the conditions so that people in my organization can act, learn with purpose and speed?
This is one of those instances where, to bring your airplane back, we are assembling, fixing, and trying to figure out how to do it while we're doing. What's your evaluation of how we are succeeding at the moment?
I would not give us high grades as a society for our response. I think we're decentralized too much to the state and local level, for example. Doesn't make sense to have 50 different states competing with each other to get masks. It doesn't make sense to have 100 different cities, each supporting their own research effort towards a vaccine. I think there's some decisions that have to be made centrally, and we're probably making too few decisions on a central basis. Given how easy it is to flow across state borders, there needs to be some commonality with respect to policies involving masking. Would be another kind of example. Organizations, I think that's something that each organization needs to decide what its own degree of centralization is. One of the many reasons why I found myself in very great controversy during my time as president of Harvard was I thought the university ought to have common policies in a bunch of areas, like what the classroom schedule was, what the financial aid policies were. And other people thought the School of Public Health should have one policy and the college should have another policy and the law school should have another policy because that was flexibility in decentralization. So I don't think there are any hard and fast rules. And one of the important arts and skills of leadership is understanding what to delegate and what to cause to be defined by a common culture and a common approach.
Larry, I've got a question about the degree to which this has been politicized. And of course, this is something that concerns me a great deal in the work that I do. The questioner asks, what will it take to depoliticize current events like COVID-19 and the subsequent focus on healthcare inequality? What it has done, I just want to expand on this, what it's done is it has caused people who haven't really thought of healthcare equality as clearly as they have to realize that there are segments of society who will suffer more from this because their healthcare inequality leads them to have underlying illnesses that others don't have. They don't seek or have the healthcare coverage that they need, and particularly communities of color are getting the disease and dying of it at greater rates than the general population. How do we address that reality without it becoming a politicized issue?
Give you two answers to that. One is that people are always heard much more vividly when they're saying things that the world doesn't expect them to hear. So CEO of Fortune 500 company talks about the problem of health disparities. People are listening. Public health advocate talks about the need for more business incentives and the burdens of excess regulation. People are listening. On the other hand, when business leaders say we need less business regulation and public health leaders say we need more money for public health, it's pretty predictable, and therefore people listen less. So part of it is whatever the belief is, look for a non-traditional advocate rather than a traditional advocate. And I don't think the business community has, with some exceptions, I don't think the business community has done a particularly good job on speaking up on public health issues and health disparities. Second thing I'd say is you just need to get the facts out. I mean, the facts are stunning. If you eliminated all cancer for a 25-year-old, for the rest of their days, you said they had zero chance of getting cancer, it would add about 4 years to their life expectancy. If you look at the difference between a poor American and an affluent American male, the difference in their life expectancy is about 10 years. And so when we look at African Americans, when we look at those of lower socioeconomic status, they are carrying an incremental health burden that's greater than the health burden of cancer. I think if that were more widely known, people would see it as unjust and wrong.
Who's the message bearer for that? When you hear it from somebody you don't expect to hear it from, it'll be interesting. At the moment, a lot of the message bearers for this are political people. Some of them are candidates who were running for president. How do you get this message out here? Because the economic return on investment can be greater than it is in America, right? Where we spend more per capita on healthcare, in some instances without better outcomes. That's a logical, economic, even somewhat conservative argument. In a lot of countries that have universal healthcare, different approaches to it, brought in by conservatives. It's kept up.
Here's a suggestion. If every Fortune 500 CEO said that over the next 2 years, they were going to say as many words about health disparities as they said about excess healthcare costs and competitiveness, it would change the character of our national discussion. And that's something that is achievable. If initiatives using information technology were half as frequently directed at improving the quality of care as they were at improving the reimbursement of care, that would get people's attention. You look at the major information technology investments that are made by the great hospitals in this city, and you ask how many of them are directed at making sure that no service provided goes unbilled for, making sure that no opportunity for efficiency by having someone leave earlier is missed, and how much are directed at discerning who are the 15% least competent physicians in their midst and giving them the necessary training to pull themselves back up to standard or to leave that environment. And I promise you that the investments are disproportionately on the side of cost control. And ultimately, if we could infuse that kind of quality focus, we could do much better.
We talked a little about vaccines. I want to just play a clip from Julie Gerberding, the Executive Vice President and Chief Patent Officer for Merck.
Right now, there are 130 vaccines that are in development, and 13 of them are already in clinical trials. I mean, just think about that. We're only a few months into this, and we have already progressed to the point where some companies are hopeful that they'll have vaccines available to people before the end of the year. So science is on our side. But that doesn't mean we're going to have instant success. And one of the things I worry about in this context is not over-promising and then under-delivering on either the timelines or the safety of what we're creating or the access that people around the world will eventually be able to get. So we need to solve for more than just the product. We have to solve for a whole set of solutions.
Larry, I want to ask you about the over-promise, under-deliver thing. I think Julie understands that. I think you understand that. I think everybody at Harvard School of Public Health understands that. I'm not asking you to go after the president again, but the idea that we're promising, strangely, a vaccine by the end of the year and possibly November, which conveniently falls right around the election, it does border on irresponsible, given that this is a vaccine that probably will be in greater demand than any vaccine in history, including malaria. Everybody's going to want this, and we do actually have to make sure it's safe.
You are asking me to go after the president again.
Just a little.
Actually, but he deserves to be gone after on this particular question. I think that there's always a challenge as a leader when you set a date for something. Because on the one hand, it for sure will not happen any faster than your timetable. And so if you set a more ambitious timetable, it will tend to accelerate progress. And on the other hand, you want to be telling people the truth. And so the job of a leader is not the same thing as the job of an objective forecaster with a data system working to set a target. If John Kennedy had said, we will put a man on the moon when we're able to do so in a fully safe and effective way after consulting with all the relevant engineers, he would not have moved a nation forward in the way he did with the audacious objective of putting a man on the moon in the decade. So I think, like most of these things, they involve a kind of thoughtful and sensible balance. And you do have to lift people's sights, but at the same time, you have to maintain contact with reality. I think that part of it's that. The other part of it, Ali, is careful use of language. There will be a time when a company in a clinical trial will have had success with a vaccine. The moment, it will be months, maybe a year from that moment until most Americans will have been vaccinated in a way they trusted. And so part of this is people need to hear carefully what is being promised and what is not being promised.
Larry, one of the conversations we've been having is creating value for shareholders, creating value for businesses, but how to do that while creating value for all of society. I want to play a clip from Mandel Crawley of Morgan Stanley discussing what creating value means and how businesses can do more. This is obviously an area of your expertise, given the various positions you've held. Let's listen to Mandel Crawley.
It's never been more acutely obvious to us that we have to do more. I think the CEO Business Roundtable announced, I forget if it was late, I think it was late last year when they said the responsibility of corporations is much higher, it's much greater. It goes beyond just delivering value for shareholders. I know that there are some Milton Friedman followers that are out there that probably bristle at the fact, but without question, we have more to do. And so when I think about our job and our role in the capital markets, we're a business that obviously is entirely dependent upon human capital. In the final analysis, we are a relationship-based, talent-driven organization. If you don't have the health and wellness of your employees, none of the other stuff matters.
So Larry, it's sort of full circle of our conversation because I started by quoting Milton Friedman. Do you think we're making progress on this road? I actually do. Having seen businesses respond to coronavirus and then to Black Lives Matter and these protests, I'm beginning to feel like this is getting to a place where corporations understand that humanity and the population are their stakeholders.
I'd like to see some more emphasis on walking the walk rather than on talking the talk. If every corporation that decides to fund a charter school in its home city decided instead to stop distributing substantial amounts of political money in support of tax breaks, I think it would make the world a significantly better place. And I'd like to see a little more emphasis by corporate America on the side of the Hippocratic Oath. First, do no harm.
Yeah.
And if they did less to subvert government, by subverting government budgets, by eroding tax bases, and then saying how wonderful it is that their corporate foundation did X, I think the business community could make a larger contribution to our society. But look, I think the spirit with which Michelle started this program, that our problems are sufficiently profound and sufficiently complex that they require a role for universities, they require a role for businesses, and they require a role for government, and that everybody has to do their part. I think that's exactly the right attitude. And if I've made some critical comments about business, it's not because I don't think that their role is crucial. It's precisely because I think it is so very, very important. And let me just, if I could conclude my bit by just saying that I think the work that is being done at the public health school, that we've had a chance to highlight a few of the faculty who are involved, is just immensely important to the legitimacy of our society, because nothing is more fundamental for any of us than our health. And whether it's a better screening test for cancer, more affordability for people who would otherwise not have access to health care, wiser policies for keeping people safe during this pandemic, I think that that work gets done as effectively as the work of marketing or accounting or inventory control, or what are frankly the better funded activities in our society, those of business, is immensely important. And so I think this idea that's behind this series of business and public health partnering in the long run interests of both is really a very, very powerful one. And I'm very honored to have had a chance to participate in it.
Larry, we're out of time. I want to thank you. But before I do that, I want to thank Dean Michelle Williams, the Harvard School of Public Health, those of you who have joined us, and a special thanks to the New England Journal of Medicine, our partner in this. This series, When Public Health Meets Business, will continue. Larry, good to talk to you again, and it is a real treat to talk to you for more than the amount of time that we get to talk on TV. So I hope this continues, and I hope you'll join me on the channel. Thanks to all of you for being here for this really, really important discussion. And thank you to the New England Journal of Medicine and to Harvard for having me participate in this. Have yourselves a great rest of the day. Thank you.